So can we prevent heart attacks? Give us some good news.
Yes, we can.
Yay.
But this is the thing. Prevention starts with you, with the patient. So if you know that in your family there's a history of strokes, heart attacks, sudden death, cholesterol issues, hypertension issues, diabetes, you're the first person that needs to identify yourself as someone at risk and then seek medical attention so that we can modify the modifiable risk factors.
Right.
And a lot of them are modifiable, if not all of them. I would like to say that the first one, that's the most critical one and most easily to modify, is smoking.
I knew. I was going to say, I know which one you're going to say, which is stop smoking.
Stop smoking. It is interesting. Your risk of cancer will take about 8 years to go away and become the same risk of cancer to the general population if you stop smoking. But as far as cardiovascular risk of death, stroke, and heart attack, that risk goes away within weeks. Okay.
Our viewers at home are watching now, and we have these preventable measures. And again, the first one being stop smoking. I can't stress that enough. Dr. Majano can't stress that enough. What else do we got?
Well, obviously, good nutrition. And by good nutrition, we don't mean just eating fruits and vegetables. You need, obviously there's people in our community that choose to be vegetarians, and that is okay. But not overindulging in foods that have a high percentage of saturated fat that is solid at room temperature. Checking and knowing your numbers meaning your blood pressure, which may not give you any symptoms like I mentioned at the beginning
Right.
of the program. Knowing your cholesterol numbers, your good cholesterol, the bad cholesterol. If you have a bad family history, you might not just stop at numbers, but actually at more specific tests looking at the types of particles of your cholesterol. You could have the really, really bad atherogenic LDL particles that cause a lot of heart attacks. And
that
plaque
LDL
buildup.
cholesterol is very bad.
It's bad, but there's several levels of bad.